I just really want to quickly welcome you all and welcome our panelists, Rosemond, Ashley, and Michelle. Thank you so much for taking time out of your busy schedules to be here with us today.
My charge.
You charge? Or you've got to be out of here at 11. And I know you are all, it's a very busy time for you in the semester, so thanks for squeezing this in between classes and everything else that you have going on. I'm Sarah Benning. I'm with the Center for Leadership Education and Maternal and Child Public Health, and we with the Programs Office have pulled this together today.
Good morning. Good morning. My name is Rosemond Owens. It's a pleasure to be here. I work for Blue Cross and Blue Shield of Minnesota. And Blue Cross is the largest health plan in the state of Minnesota. And Blue Cross has the largest membership and the largest network of providers. So Blue Cross is in all the 87 counties in the state. So for 85 years now, Blue Cross has had a history of making a healthy difference in people's lives. So I am a Pan-African and originally from Ghana. I have 3 daughters and a husband.
Good morning. I'm Ashley Mitchell, and I am newly an instructor with the Rothenberger Institute, which is part of the School of Public Health here on campus. They teach 1 credit undergraduate courses that are all online on wellness topics. So courses include alcohol in college life, sexuality matters, success over stress, and sleep, eat, and exercise. So I just started there this fall. I met Sarah through my previous position where I was a program manager with Wellshare International, and I was there for just over 3 years. And they are a public health nonprofit that uses a community health worker model to do education with immigrant refugee communities locally. So today I'll talk a little bit about both experiences, just knowing that I spent a lot of my recent past there and I'm still learning my role with Rothenberger. I've also been an adjunct instructor for different public health topics at St. Kate's University and St. Mary's University, and so that sort of shaped my role back into academia. So I'm a mixed bag, I guess, today. I have a few different hats. And I've got a 1-year-old at home and consider Minnesota home, so I'm glad to be here with you guys.
My name is Michelle Chiezah, and I am the State's Infant Mortality Consultant or Expert or Specialist. You can pick from those 3. And so I work for the Minnesota Department of Health in the Maternal and Child Health section, more specifically within the Women's and Infants Health Unit. So my job is to provide statewide leadership around infant mortality reduction, improving birth outcomes, and so I have a very, very huge hat. My head is not that big, I hope not. But it's a very big role, but nevertheless one that I thoroughly enjoy. And I've been in this position for about 6 years now. I've been in public health for about 2 decades, almost 2, going on 2 decades. So I've had different jobs elsewhere and different experiences, but I'm really happy to be here today. I'm married, but I don't have children. And I am from the Caribbean, if you notice some kind of accent. So we all have global experiences up here, which I'm sure you appreciate. And we're talking about earlier how much stuff you have on campus now. Like when I was here, there was no train, and this was many, many years ago. So it's not like I came to school on a horse of buggies.
So one of the questions that bubbled up was, how influential was the MCH program in leading you to your current role? Students were interested in knowing about influential tools, skills, or takeaways you gained during the program, any events, classes, or opportunities you had, the best things you thought you did to prepare for your career, any internship or specific job activities that you undertook during your time here. So feel free to address any of those.
Okay, I'll go first. I think in terms of the most influential tools and skills that I took away from this program, I think it's very important that you have some analytic skills under your belt, especially in this day and age, and some very critical thinking skills, and some good writing skills as well. because wherever you go, writing, all these skills are transferable and you can always sharpen them. It's also very important to be a good listener, not to be a passive listener, but you have to intentionally listen to what people are saying and be able to take criticisms too, because you're not always going to have all the answers to everything, and we are all still learning. Nobody ever comes to the table with everything. And criticism is good at times because it helps you to also strengthen your own skills. So just be willing to do that, and listen. Have some interpersonal and problem-solving skills. Those are always important. I'm sure you've heard of all these things before. But I am in this position. It sometimes feels like I'm on my own, but I'm not. But being able to work with others is critical. I know when I was a student here, there were projects that we had to work on together. I like working on my own sometimes, but when I came here, I had to appreciate that a little bit more, because when you go out into the real world, you will meet people, and people will need you. And so being able to navigate networks and working with people very well, those skills are extremely critical. So, yeah, and leadership skills, because there are projects that you're going to have to work on and lead them. I lead projects at the health department, and so it goes along with the interpersonal skills. So I think those were some of the skills that I gained here. I came into this program with a master's degree from the social sciences, studying demography and so forth. And when I wrote a paper, I did it on my own. I didn't have group projects, and so when I came here, I had to learn how to do those things. And believe you me, I am grateful that I was able to work in a group setting with students, and because they all transferred. So, let's see if nothing else you guys want to add.
Thank you.
I don't want to be the voice of us.
I would agree. I think you spoke a little bit to the softer skills.
Yeah.
The listening, the communication. I think those came along the way. Some of the, you guys had asked some of the classes or some of the specific events on campus. And I think some of the most influential pieces for me included the classes and the networking opportunities. And so the classes where you get to develop a very specific sort of resume skill, which were not necessarily the most enjoyable classes to me. I'm thinking about class or evaluation. When I went through the program, there was a children's advocacy class where we developed an advocacy portfolio. Those classes where you leave with something physical to be able to show to your future employers were really valuable. So I would say balance that while you're considering which classes to take. Those enjoyable topics where you get to do a lot of the thinking and the theoretical readings are important, but equally important is being able to walk away with some of those hard skills. And then the networking opportunities. And so throughout my program, I think I did 3 internships or consultancies and had a job at MDH, which is a lot to juggle when you're a student, but really set me up to be able to dive into a career right after I graduated. So the Community Health Initiative program, have you guys heard of that? I participated in 2 internships and a consulting position with them. One of them was at Wilshire International, and so I spent a year consulting with them, and then later was hired on as a program manager. And so I think the MCH program created networking opportunities to me that were invaluable and relationships that I still have today. And my current position at the Rothenberger Institute, the director of the institute is Jerry Cholhog. And during my MCH program, I was the MCH representative for the Epi and Community Health board, and Jerry was on that board. And so we met at that time, and I sort of stayed in touch with her over the years. And then when this opportunity came up, we already had a connection, which made my interview process a lot better for me personally, right? Because we had lunch and we had been on this board together. And so, yeah, so I think that's not something that's necessarily built into the program, that networking piece, but you'll keep hearing that it's all about who you know. And the public health field in Minnesota is fairly small in terms of, like, Michelle and I have worked together on networking committees before. And so, yeah, as you start to go through the program even more, work on networking and do the lunches and serve on the boards and do the internships, even though it's time that you could be using to study or sleep. it's well worth
I
it.
agree. I agree every day. I have everything written down here that you just said.
Yeah, it's the University of Minnesota has such a good and recognizable name that I think that makes the networking a little bit easier.
And to add to that, I was a non-traditional student, so I was working full-time and going to school. And one thing that I took that was very important was the core classes. Because usually for MPH students, you want to get done with the LP, the biostat, and get on with our business, right? Yeah. But those are very important because, Michelle talked earlier about analytical skills. Those are so important. So please take them seriously because it will benefit you. Yeah. I so regret that I took my pass or fail because I didn't have time for that. I wanted to go do like adolescent health and those fun stuff. But the MCH program is well-rounded for a reason, right? So each part of it is important. And it took me, now that I'm almost 50, to realize that. So please pay attention and go to those classes. And if you need help, use the faculty, right? The graduate assistants are very good too, And so that was one of my key takeaways. So even though I wasn't very serious about that, I realized that it was important for me. So that was one skill. So being able to say that I could do SAS, right? And even though I didn't take it as serious as I should when I was on campus, it was important that I had those skills. And of course, I am a networker. Like, I know a lot of people, and a lot of them I got to know on campus. So even though I was working full-time and I was a mother, I took time to attend some of the things, on campus. And once you know somebody from the program, it's for life, right? So take advantage of the mentorships too and use your mentors really well. My mentor is still in life today, right? And they are valuable because they know what it is to transfer being a student to now being a professional, a public health professional. And those learnings are very important. And more often than not, we don't have to leave it to them. We have to engage, right? And be willing to learn and be willing to ask questions of them. So that's my piece.
Yeah, I was going to add that we actually talked about the hard skills and I've written down some stuff here. So basically going above and beyond the minimum core requirements. So if there's a class on R, take it. If there's a class on SPSSS, take it. And not just taking those classes, but applying them and having some sort of deliverable. If there's a paper that you need to write, maybe turn that into sort of a research paper. Something that you can deliver to an employer, say, see, I can do this. Because some of you came straight from undergrad, don't have a lot of experience, and these are marketable skills and marketable tools, being able to turn around and say, I did this. I had sort of portfolio, so when I was interviewed for a job, I gave them a folder with stuff that I'd done. So make sure you take advantage of those courses, a policy class. I don't know, when Dr. Forster was here, there was a class on population health where you actually sort of did sort of a legislative kind of internship and you were able to work on some kind of policy or shadow somebody working on policy. That kind of class is useful because it's an opportunity to network. Sometimes the public health world in Minnesota, at least I found it to be impenetrable. So having those relationships when you're in school, seeking out opportunities, if there's a posting for a job somewhere, and you have time to do it, go after it because it's another way to gain opportunities. If you're from out of state, set up some informational interviews. If you want to go back to, let's say you're from California, go back to California, make sure you set up some informational interviews and try and meet people. If you want to work at the health department, network that way. Attend conferences in areas that are you're interested. If you're interested in immunizations, go to immunizations conferences, check out some local conferences. Those things are very important. Because the more you show up, the better it is for you. And make yourself known and useful.
And also, I think to add to that, take advantage of the MPHA. So the MPHA here have rates for students that are quite minimal. But I think that most of the MPHA members are the leaders, right? Public health leaders in the state. And so being out there, making yourself known, engaging with them, also creates opportunities for you because at least they know you, and when those opportunities come up, you know who to talk to. or who to call. And internship opportunities, please, I saw many. I wish I was still a student, right? So when I was standing there waiting for the class to finish, I looked and said, oh my goodness, I could have done this, could have done that, but this is all after the fact. They said hindsight is 20/20. So you have an opportunity now, you're still here, take advantage.
Other questions that students had was when they should start seeking opportunities, and it sounds like part of the answer is
Like
now.
now.
But then there are some specific questions around how to prepare to work with people with diverse backgrounds. And then a question around finding balance when working with people who have intense, traumatic, or difficult experiences during their life stages that affect their development, or while trying to access services, which I think is a great question.
Thinking about specifically preparing to work with people of diverse backgrounds or people who have experienced trauma, there are tons of resources on campus that I learned about, I think, late in my MCH program. And Sarah, do you know what the Office of OED,
Yeah.
what does that stand for?
Office for Equity and Diversity.
So Office for Equity and Diversity, and then there's ISSS, Intercultural Student something. You can go on the UMN website and look up those two acronyms. They both hold workshops that are free to students and staff very regularly on this topic. And I would say this topic takes a long time of consistent, intentional work. And so take advantage of those opportunities and just go learn. Take the extra hour to go to the workshop that they're doing. And then in combination with that, I would also just say, expose yourself to scenarios or working groups where you are the minority and practice those skills that Michelle talked about, right? Listening, learning, approaching with an attitude of humility, and just knowing that if you don't have that experience yet, part of preparing is just watching how others do it well. It takes a lot of time, right? Like I don't know that any of us have mastered either of these things yet. You guys are maybe a little further along than I am, but I think it's a lifelong skill, and part of it is keeping that mindset that you haven't mastered it yet.
And another thing I would have to add is intentionality also. So you have to intentionally broaden your networks.
Mm-hmm.
And you are blessed to be on a campus which is very diverse. And when I was here, it wasn't like that. I remember the MCH class, it was me and a couple who were of diverse backgrounds. But then I look around campus and I see that it's very diverse. So take advantage of who is in your network and intentionally do that. The more, it's all about learning about one another, right? Understanding where you're coming from, understanding your perspective, and me understanding, me understanding yours and you understanding mine. That is what it's all about, right? So then we can learn some shared commonalities, Another thing in Minnesota is that there's so many advantages here in this state of volunteering opportunities, right? So you're close to a lot of hospitals, within a 20-mile, maybe 15-mile radius, and these hospitals have diverse patient populations as well. And they're always looking for volunteer opportunities. So not only will it help you increase your awareness of the other and learn about diverse backgrounds, you also are networking in these opportunities, because that is where you would go to when you're looking for opportunities. And having all this on your resume is also important. So take advantage of that. And I was here on Saturday, and when I was here, the only food joint was where I could get hamburgers, right? But now there's even Afro Deli on campus. Mm-hmm. And so it's so diverse. So another place that you can also learn about others is even taking advantage of these diverse culinary opportunities, right? That you have to engage your palate also, right? And in that way, you're learning about the other, getting an appreciation for what is different also.
Yeah, I'd like to add a little bit of different perspective. So I work at infant mortality, and that problem is something that affects mostly American Indian and African American, let's say US-born blacks. Because if you put the Black/African American, really when you take apart that data, the problem, the biggest gap is between, the US-born black population and whites in the black population. And so I think one of the things that I had to do in coming into my job, because I work with communities, is to actually mention being humble. But and we have to listen, okay? So you have to listen to what, and don't think you have all the answers to their stories. Their stories are based on their lived experiences, and it's for us to listen to them and work with them in trying to find solutions. And we don't have the solutions, and sometimes the best solutions come from the community. So we have to be intentional about listening and realizing that we don't have all the answers. The other thing is, so after I left this program, I went to work for a number of years. I did research for a number, then I went back and I started a doctoral program, which I have yet to finish. But I have had a lot of statistics classes, beyond statistics classes. I mean, statistics up to statistics. And so when you're in that world, you can feel a little bit indifferent about things sometimes. So, you know, they talk about your N has to be this much for something to be robust and a good analysis and whatnot. When you come into communities, what you might think is not important, like an N of 1, like 1 death, to the community, that's a big deal, especially if you are an oppressed community, a community that's experienced tremendous trauma. Just think about the black population that's been here since slavery, and also the American Indian population that was here before Columbus and whoever landed here. They've been through trauma, and so you have to come with that, knowing that what you may think is not important is important to them, because they come with their lived experiences, and their lived experiences has this very bad, it's traumatic. It's a traumatic experience, so it's always good to know that.
And to also add to that, at times, whether we come with a savior mentality, we've come to, you know, and we forget that communities are resilient and they have the solutions as well. So even me, as working for a health plan, we have all these plans to do interventions, you know, and it's somebody sitting in a cube somewhere in Egan thinking of solutions for somebody that they know nothing about besides what they have read, you know. So I think having communities participate and having them have a seat at the table to come up with solutions together is a very good practice. I also want to talk about trauma-informed care, because I think that a lot of us don't really understand, you know. So, because we haven't lived through those experiences. There's a lot of classes on trauma-informed care. And I think it's very important to take advantage of one of them, at least get your eyes open to some of the other determinants of health, right? The social, the economic. What else makes a person healthy? And I think for a public health perspective, it helps too, as you use public health principles, understanding all what has taken place to bring communities to where they are today, you know. And most of the time, we don't think about that. I heard somebody talk about the encampment, you know, the encampment on high water, and this individual is very close to me, and he said, you know, the jobless rate in Minnesota is very low now. How come they don't find jobs in homes? And I almost bet you'd have seen me on the news with the police. I was so mad. I said, do you have an inkling, right? Have you talked to the homeless people? Do you know how they got there? This is our problem as a society. We play judge and jury. We know what your problem is. We are going to solve it for you. And then all the time, the very important factor is we've taken you out of the equation. And I asked him, I said, who do you think anybody, if they had that, would want to live close to a highway in a tent? You know, so we need to really understand and be socially conscious, you know. My 12-year-old always says she's woke, right? We need to be woke. We can't be asleep and then call ourselves, you know, MCH professionals. We need to be awake to what is out there.
I was going to ask you, there's a PhDR program here, the Health Disparities Research. Is it still here? And I think it was that group who came to MDH once and offered us some training on like a session or something on community participatory research. And if there are classes in that, I think that would be valuable, because it really helps you to understand how to work with communities and see your role and their role in the work in trying to advance some health cause.
And I think that makes me remember, I think Dr. Kathleen Call, I don't know if she's still here. have coffee or tea with her. She's had a lot of experiences working in community.
Yeah.
And she can, she has a lot of research too that she can share with you. But reach out to her and tell her you're interested in how she's managed to do some of that participatory research working with communities.
I would add Dr. Rachel Hardiman too.
Yeah.
One other thing you guys both made me think of related to diversity and trauma is make friends across disciplines. And some of you might be doing a dual program, but make friends with social workers and make friends with lawyers and make friends across disciplines, because a lot of these social determinants of health aren't going to just be solved by public health professionals.
Yes, absolutely.
So, yeah.
That's very true. I would agree with you, because it's so much more complex than you would realize. Right now you're kind of siloed in MCH, but the world is bigger than MCH, and we need other people to make MCH happen. It's just the reality.
And another thing, that the MCH program is very versatile also, right? So I haven't done purely MCH work since 2006. So you can apply public health principles. So I took the social justice part, and I went straight into equity, right? So I've been an equity practitioner, but then always with an MCH. So at the back of my mind, right, those principles are still there. But you have an advantage also, that because this program actually encompasses social justice and equity, right? So take advantage of that as well, because you can actually morph yourself into anything that you want to be, using public health principles, right? So this is your core MCH. You never forget that, but then there's a lot of other opportunities too, where you can bring your skills. And Michelle talked a little bit earlier, and actually alluded to that too, about it being very transferable. Trust me, it's true.
People want to know about life right after the program.
Okay.
So any skills that you developed during the program that you used right when you got your first position, and then maybe it would be good to hear about the types of positions that you had between your program and your current job. So I think you probably want to hear about that transition phase, right? So talk about that and some of the things that you did during that time and to prepare for that time.
Okay, so I'll start that off. So while I was here, and Ashley mentioned some of this in terms of her experiences, I was, this was back in the late 90s, 2000, early 2000s, so it's been a long time. I actually, like I was talking about, we were talking about earlier, you've got to seek out opportunities. So I was able to intern at a very up-and-coming project at the time. They were looking at health disparities. And there was some kind of report that was issued based on some research that was done between the Minneapolis Health Department and the Hennepin County Human Services and Public Health Department. And I was just a student on that project, and out of that project, part of my deliverable was to help with putting together a data book, looking at health disparities within the several county metro area, and then a report, that accompanying report. So that sort of then became, it morphed into my master's project somehow, because it was also very connected. And then at that same time too, that same summer, I was also a student worker at the health department. And what I didn't know, something called home visiting. I didn't know what home visiting was, but I learned when I got there. They were looking for somebody to work on data, but the data part didn't work out because there were some issues with the data, that they hadn't gotten the data or something like that. But I ended up doing other things and learning so much more. I learned how a health department functioned at that level. And so, skipping over a bunch of times here, somehow I ended up at the Hennepin County Human Services and Public Health Department. They were looking for senior research analysts, and I ended up being that person because I already had those connections and I'd proven myself with the work that I'd done. So I applied for the job, and I had this portfolio because I had all these deliverables from work that I had done as an MCH student, working on fact sheets for the extension services, some other, the analysis that I'd done, with the assessment that I'd done for the projects that I'd worked on. And so, so that's what Ashley was talking about. Making those connections early, starting on projects early, sometimes it pays off in the long run because you've already established connections and you've already proven yourself, and it makes you more marketable. So that was easier.
Yeah. And to piggyback on that too, so I mentioned earlier that I was working already at the birth certificate office at the hospital. So when I was in the program, I spent a lot of time with the pediatricians and the OBGYNs. So that created opportunities for me, and I was able to do a master's project around, my master's project was around a program called Baby, Birth and Beginning Years. And the whole program is supposed to reduce subsequent births to teens who've already, and so right after I was done with the program, I got to be able to work, I was done with my program, I got to be able to work with the individuals who were working on the project. And one of the biggest things for me was the part of a birth recorder's job that people didn't know was the collecting the data for the Department of Health statistics, right? So every mom who has a baby, the hospital is required by law to collect maternal child health aggregate, so that all goes to inform what the state people like Michelle and other professionals at the state work on to reduce whether it's infant mortality or maternal mortality, or reduce some of the complications that arise. But so coming to school, and then so at first I said it's a very boring job, right? But I realized that when I realized that data mattered, right, then I was able to even influence the hospital's work around that. But it was all because I was doing the job before I started the program, and I think, why would they have a human being do all of this, right? And I'm thinking before. But then later I said, oh my goodness, why shouldn't a human being do this? Because this is very important and it informs policy, and right. So it was very helpful. Then all of a sudden there was a pivot for me, right? And I knew that it was going to help also with my career. So even with that the data, a lot of the work that the hospitals started doing around maternal child health stemmed from the information that we already had that we didn't know how to utilize and how to leverage before. So whatever you're doing right now, nothing happens by chance. There's always a connection. Mm-hmm. So look for those connections, right? And then you'll be surprised too because I would have left the school with nothing, but then because I compiled everything that I was doing and I saw it through the eyes, so I always make myself very important. My shoulders are always up. I'm an MCH practitioner, right? Never been done right, but you have to. Yeah. So you have to see yourself that way. Don't worry if others don't see you like that. Yeah. But so you're just a birth recorder. I said, no, I'm an MCH practitioner, collecting data for the state, right? So whatever you're doing now, see value in that and see that it connects to something else, right? So it's the totality of all you are, your lived experiences, your experiences right now that is going to help, right? So don't think that anything is wasted. No, okay? You're going to need it.
I'm not even a panelist anymore. I'm just learning how to be. I feel inspired. Thank you.
Well,
I don't know how to piggyback on that. So I'm a much more recent grad. We were joking earlier. And I have had 3 positions since I graduated. And I would say my best advice about just being having just graduated is have an open mind, keep a posture of learning, and be patient. To Rosemond's point, the public health field is really broad, and the skills that you have are going to be really applicable in a lot of different ways. So you might choose different careers at different points in your life for different reasons. So I think I left the MCH program eager and excited to work in women's health in particular and work with pregnant women, and I felt a little bit discouraged at first, feeling like I can't find a position that matches all of my passions and that uses all of my skills or something like that. And I ended up working right away at a federally qualified health center in North Minneapolis, which was where I was living. And so I could walk to work, which was an amazing benefit. And I ended up learning a ton about local clinics and about working with providers and with community health workers. And a year later, a WellShare position opened up, and I ended up being a program manager for WellShare, where I was working with a more global population and a lot more on maternal and child health issues, which I was really excited about. And through that opportunity, I kind of kept an open mind and ended up doing some adjunct teaching and learned, gosh, I'm really excited about teaching and I love being in academia. And that started to shift my career in another way and shaped where I am now. And I think, yeah, just being open-minded that you might be somewhere working on a tobacco project for a few years. And instead of thinking about, gosh, I don't want to work on tobacco for my whole life, what am I doing here? Try and use that experience and think about the skills that you're gaining, the relationships that you're gaining, and the ways that you might be able to leverage that in a future experience, knowing that there are going to be future experiences that might better align with both your skills and your passions.
Yeah, and I was going to add a little bit to that too, because I ended up my career being in research mostly. And so remember we're talking about these analytic skills. They're so transferable because I am a high-level planner now, and it helps me a lot. I'm a much better planner because I can understand data. I'm pretty much, I understand data. I understand how to use data. I understand how to use data in shaping policies and programs. And yeah, so I agree with everything they say, that even if you get an MPH and MCH, you may end up as a data scientist at Blue Cross Blue Shield because you have taken all these amazing courses and you know how to use all these different statistical software packages. So yeah, the world is open back for you.
So I want to talk about boldness also, right? So be bold. Have you heard of the 17 Sustainable Development Goals, the SDGs?
Yeah.
Yeah. So go look through the SDGs. So recently, organizations in Minnesota, now everybody is talking about sustainability and talking about global, right? So even small organizations here in Minnesota are thinking, how do they contribute to the SDGs? And as you look through the 17 of them, there's a lot too, right? So then you broaden your mindset and your perspective, and like you broaden your wings, sort of, right? So the part of boldness. So let me tell you something. Because I have an MPH, right? In MCH, for any position that I think I'm interested in, I can get it. And that's a part of the boldness.
That's bold.
Because those principles, those principles that you actually acquire here, right? I surprised myself, right? So I went to work at Central Care Health in St. Cloud. It was a new position, and the St. Cloud community was becoming very diverse in the early 2000s. So they wanted somebody to come and help create a strategy around how they can engage more of their diverse patients. I didn't know what that was, but as I looked through, I said, oh, I can do this, I can do that. But so but I knew that based on the requirements and based on the training that I had, I could. So the skills that you're going to get are very, 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 very transferable. Don't be shy, be bold.
It's true.
And you see, the planner is saying that, she's a data woman. If she says it's true, then it's...
It's very true. I mean, I've seen people with MPH at the health department doing some amazing things that people with PhDs aren't doing. So, I mean, I see that. So, you just take this program and make it into what you want it to be for you.
Exactly.
Just back to statistical knowledge, I mean, do you think we should stick to SAS programming or kind of learn R throughout our time here? I mean, what's your recommendation?
Whatever is available to you, because
Okay.
some places may use one software package. What if there's another job somewhere else that requires R but maybe not SAS?
Okay.
Knowledge in that. So whatever, whether it's Stata, I love Stata. I'm a Stata person. Whatever software packages are available to you, just make sure if you want to go into that direction, I would say, yeah, learn as much as you can.
Okay.
Because, this is kind of like the time for you to do it. Sometimes people leave it, they get married, have kids and families. Your life course changes sometimes in a way that you didn't expect, and you go back and you say, I wish I had.
I would add to that.
GIS too, sorry.
No. Yeah, you can take one of two approaches. You can learn every single one of them available to you. I would add that from my experience, learning one and learning it well, it can be transferable. And so if you want to apply for a job in the future that requires STATA, for example, but you are really knowledgeable about SAS and you have it on your personal computer and you can use it, you can still frame that to say, I'm really knowledgeable, I can quickly learn another comparable data processing.
But if you have time, I want to learn them. It
Yes.
doesn't hurt. Because you're always competing with somebody else
Exactly.
for a job. And so sometimes some people know it very well. It's not just saying that I've taken a class or I've opened it up and I know what it is. It's also about knowing how to
Using it.
use it.
Yes.
Because always think, you are always competing with somebody else. Somebody else sometimes is better than you. So you want to be better than that person, that hypothetical person you don't know who's interviewed. Yeah, so just think about it that way.
Thank you.
In terms of classes, and this is hot in the public health work, QI, quality improvement sort of courses. If those are available, doing PDSA cycles, testing on small changes. Just a skill building thing I wanted to mention to you guys, because that's big and it's a big deal in the public health work right now. And there's an institute called IHI, I don't remember what it stands for, but it's all geared around the whole QI kind of work. So you might want to go and Google that. Thank God for Google. I didn't have that when you
I'd be curious about hearing for each of you a current job or I guess a past job, just how the responsibilities actually broke down. Like what % of your time did you spend doing particular things roughly? Just to give us an idea of what you're actually doing out in the field, because it all seems so far away sometimes to us. Oh no.
I would say, I'll just start and then we'll probably go back and forth. I would say, from my experience, most public health professionals have the hardest time summarizing or answering that question.
thank you.
What do you actually do every day? Because we all do so many different things every single day,
Sure.
which is part of what I have loved about all the positions that I've done.
Yeah, it's true.
So my positions have been a combination of supervising people, doing some program planning and evaluation, so some of that sitting at your computer, doing the literature reviews or working with teams to do the program planning, and then on the back end, sitting at your computer and doing the data analysis for the evaluation. Grant writing has been a part of almost all of my positions. What else? Being part of the networking groups locally, so attending almost weekly, different networking groups or meetings across disciplines. What else do we do every day?
Well, for me, because I am the state infant mortality specialist, or whatever you want to call me, expert, I mean, I'm called upon to do a lot of things. And obviously, sometimes I can't be on every group or every committee. I'd say that at the health department, we work hard. And sometimes it's hard to even find time for yourself. But I do a broad array of things. Like I write plans, I work on, health education, health promotion, data. I mean, I do it all, and so when you have the skills that you're gaining right now, because like you said, public health is fun. Let me just be the first person to, I love it. But you get to apply all those skills in so many different ways. Like right now, I got 3 assignments yesterday. One to contribute to a white paper, another one to work. I'm going to finish up an RFP, and I'm going to do something else. So there's a lot to be done, and you just don't have enough time in a day to do everything, or time in a year to do everything, but there's just a lot of assignments. And there are also federal projects that come down and they want you to participate, and you don't even know they're coming up, but somehow you're on a plane going to Washington. I mean, it's exciting, but it's chaotic sometimes.
You're working with teams a lot, I think is something I would pull out of that too.
Yeah.
Yeah, lots of project-based.
And I think also a lot of speaking engagements, right, for me. So because I do just equity and diversity and inclusion, right, so it's almost like a campaign, right? It's like public health campaign on how to embed equitable practices into all of Blue Cross, right? So it's like a campaign. So actually create like a campaign and have a campaign how to leverage the executive leadership, how to leverage this group and middle management, and then how to leverage everyone. So it's like a campaign. And I do a lot of speaking engagements on, because it's all about hands, hearts, and minds, right? So a lot of the principles, equity principles, we first need to have awareness of what it is. And then we have to learn, right, what are the practices that we have to emulate to ensure that there's equity. So I got an opportunity this year to keynote the MPHA. They didn't ask me because I was like a public, right? They knew I was an MPH, but they asked me because somebody's on the planning committee's grandpa told them that they knew me at St. Cloud Hospital, and I told them about diversity and inclusion, right, in a way that they hadn't heard before. So they asked me. So at the closing plenary, I went after Dr. Ed Ellinger, and I'm thinking, oh my goodness, how am I going to do this, you know? But I always use humor in my work. I know how to make people laugh, and I like to make people laugh because this work is hard, especially around equity, and it's so uncomfortable for a lot of us, right? So trying to apply humor to my work. So a part of my strategy, what I do is actually with humor. I make people laugh, and then we talk about their truth. Sometimes I can make you laugh and cry in the same meeting, right? So bring down your defenses, and then, you know. So like this, my other two panelists have said, it's so varied, and we all do different things, right? My daughters always ask, Mom, what do you do at work? I said, meetings. A lot of us.
Yeah.
So they talked earlier about teamwork and working with others. You're going to be working with people all the time, right? So this taking advantage of that now, so that it will be, because most job requirements are asking for people who are good at teamwork. You always see that in almost any, right? So they're wondering, how do we work well with others? That is how we are going to, whether it's in projects, whether it's in programs, that's how we are going to be successful.
Yeah, and even though, I mean, I have tons of meetings, like this morning I was arranging my schedule and canceling some of them because I just didn't have time for some things. But sometimes when the community calls upon you for something, you have to show up sometime. Otherwise, they show you up. That's what I told my friend. She said, do you have time for these? I said, no, I need to be there. You know, so sometimes you just have to also prioritize what's most important. But I do a lot of presentations. And I also do a lot of, sometimes I'm called upon to do speaking. Like last Friday, I did 3 presentations in one day. So, you know, sometimes things happen sporadically too, and you just have to learn how to prioritize or manage your time a little bit better. But at the health department, you need more time all the time, so seriously.
Yeah, and I think one important thing is, so right now when you're on projects, you know, at times you always have to pick one person to be the spokesman. I always didn't want to be that person, and I always wanted to be, so I said okay, and I always would trick my colleagues so that I'm not the one who, but then I realized that was so important, because then it taught me how to speak in front of people, right? And especially most of us are shy. So, well, most of us are shy, I would say that. I don't know whether it includes me well. But it's so important, because then you learn, especially when like you work on a project together and somebody is to present, you know, take advantage of that, because what happens is, as people criticize, you know, then you're learning those things that is going to actually happen on the workforce. Because right there, you know, you have to get up and speak about whatever idea, and then people get to weigh in, right? And then you practice that here, so that you don't take those criticisms, you don't take those things personally, right? And please don't take yourself very seriously also, you know, because that would help you, so you don't get, no. Just chill and be easy on yourself.
Yeah, but yeah, I just want to say, public health is a lot of fun. When I was working on my doctorate, I mean, I missed it so much. There were days when I was like, why did I do this? No, but it really is a lot of fun. You get to do a lot of fun things, meet a lot of fun people. And one thing I can say about public people, they're very passionate. The passion is beyond passion. Sometimes to the point where everybody shows up and there's not enough room for everybody on a topic to work on, because it's just a field where people really care, and it's because of the foundations of social justice that it's built on. People who are in public health, they want to be in public health. And so you also feed off of that energy and that passion. So when the next thing you know, you're just standing up and feeling like her.
Go back to the
the question that you had brought up in terms of balance, self-care, well-being. Like, you are people within this work, and you've identified that it can be wonderful, but it can be difficult. And so I kind of wonder what your thoughts are on that.
So a lot of intentionality, right? So you need to be a balanced person. Everybody who knows me knows that Sundays after church, around noon I eat a big lunch and I wear my pajamas and I go to bed. I sleep for like 6, 7, 8 or 9, 10 hours, right? So everybody knows that. And then most evenings also, because like Michelle and Ashley both, our work is replete with all these opportunities, right? So self-care is important, but you have to be intentional about that. And we are public health professionals. Take good care of yourselves. Eat well, right? Because usually we know how to tell others what to do that we don't do. Right? My physician had a pot belly and he was always telling me I needed to lose weight, right? Anyway, so do that, take care of yours. And then when I was coming in today, I'm thinking, what a good opportunity. Walk around the lot. That's a great opportunity. You walk to classes, take advantage of that. And make sure you hit about 10,000 steps a day. You can do it. So owe it to yourself. Oh, yes. Right? No. Because this is very important. I met Dr. Joanna Cole. She came for a conference here and she's 80. I want to look like her when I'm 80. So we owe it to ourselves and public health that we want to be around long enough to be able to continue with this work, right? So do it for yourselves. Eat well. Walk a lot, drink a lot of water. Don't let us just preach to other people. Let us preach to ourselves too and be true public health professionals.
Yeah, I walk a lot every day. I make a point of leaving my desk at 2. And I drink a lot of water because I know it'll get me up to go to the bathroom, so I get steps in that way. Yeah, I mean, I don't get a lot of sleep as much as I would like to, but yeah, you definitely have to find time for yourself. I'm not always very good at that because there are nights when I will get up and walk over things too because an idea came to my mind, or you know what I mean, and I have to write it down. And so, yeah, make sure you take some time out to enjoy the green space, at least as much of it that's available right now. So, you gotta take care of yourself too. Sit down and watch your favorite show on TV.
Learn what works for you. And
Travel, enjoy life.
related to self-care, I would say learn what works for you and make it fit into your schedule. A practice I've adopted recently is every now and then doing an inventory of my time, where for a day or two I'll just keep a little journal of what I'm doing for all the hours of the day. And sometimes you'll be surprised that you're spending hours doing things that you don't actually want to do, whether it's scrolling through your phone or, I don't know, sitting in your car. Whatever it is you do that you know that you could substitute with something else. It's always worked really well for me also to prepay for things like yoga classes. I personally love yoga, and so I'll prepay for 10 classes, right? I've already paid for it. I just need to go. It might be super stressful until the minute that I get there and get on my mat, and I'm like, I can't go to this. I have so many other things to do. But then afterwards, I go home, and even my spouse will be like, you are a different and better person. Like, we don't realize that we carry so much, and we're too stressed to take care of ourselves. But we're not our best selves. We can't fully show up and be present at places if we don't take care of ourselves.
And if you have insurance here too, to add to that, we get the fitness discounts, right? So, and I go 12 times so that I can at least get $50 off mine. But I think it motivates me, right? Mm-hmm. When I see my bill, I have to pay $130. Oh my goodness! So I'm going, and I think it's to get that benefit. But is good for me. And also try to practice mindfulness, right? It's a very busy, especially young people, right? So your lives are very different from our lives, So my youngest daughter told me that I can't stay Instagram anymore. It's now Insta, right? So like we need to keep up with everybody. We don't have to do that. We need to practice mindfulness and learn how to tune out sometimes, so you can get real with you, right? And those things that matter to you.
She and I, we go back a very long way. If you probably picked up.
Well, I'll tell you now. So, when I wanted to come into the program, I came to the office and I told, hey, I'm interested in and then the woman at the office wasn't very helpful. She was thinking 9/11 had just happened and there's a lot of people. And then I scrolled through the program and I saw Michelle and I said, she looks like me. Let me go find her. So I actually went and said, she actually helped me write my letter of intent and she helped me. So she's been in my life since then, right? So once you come in my life, you don't get to leave. You're right. So, so between Michelle and my mentor, so take advantage of the mentorship programs. Find somebody and then utilize their time well. She talked about, actually both Michelle talked about people who are very passionate about this. They're also passionate about building the next cadre of leaders in public health. So they're interested in helping you. But if you don't reach out, ask for things, don't be shy.
Yeah, I agree with you, and that was on my list too, that, I'm not a mentor in the School of Public Health, but I'd be happy. Students come and they seek me out sometimes. They want to talk, they have questions, like some of the kinds of questions that you have. I'd be willing and happy to meet with you, talk with you, maybe on one of my days off or something. We can make time and set up time. Happy to do it. And I don't charge for that.
Don't be afraid to set up informational interviews
Yes,
and reach
exactly.
out. I did the same thing.
Exactly.
Most people are willing to make time and excited.
If you want to come in a group, you can do that too.